They fly in some of the UK's most dangerous skies.
I'm being smashed about to get into the valley.
It's going to be bumpy, it's going to be turbulent, guys.
From high-rise city centres...
OK, commit to land, over the H.
...to remote peaks battered by extreme weather.
The top looks to be in cloud. Can you confirm that's the case, over?
The crews of Yorkshire's 2 air ambulances risk their lives...
Gone unresponsive.
It's just gone unresponsive on us.
...to save yours.
There's potentially fatalities involved.
There it is on its roof.
Delivering intensive care by air.
Is he breathing? No, he's not breathing.
The cow trampled me and then came back again and again.
No matter how critical the case...
This is the first time anything like this has ever happened.
He's moving his arms around and he's sweating buckets.
...however risky the place.
I'm going to get down there quickly.
He's got an almost complete amputation at the right knee.
What's your name?
Doing their jobs with Yorkshire grit.
It is from Medic 2 at the patient's side, however.
Humour.
You might get rest at week off if you're lucky.
What is it, Thursday?
Yeah.
And compassion.
OK, chick, we're just going to get you out, all right? Don't worry, we'll look after you, I promise.
This time on Helicopter ER.
Now have a quick feel of your tummy. Any pain there?
A car careers off a motorway, leaving a young woman seriously injured.
She's going to be travelling at 70 miles an hour plus.
The team raced to help a climber who's fallen 20 feet off a rock face in the Peak District.
You're always worried about head injury, that's the main thing.
Taking a nice deep breath for me.
And a man's ribs are crushed after falling off a ladder during some DIY.
Any pain in your tummy at all?
Go ahead.
It's mid-afternoon at Yorkshire's Air Ambulance HQ, and on the dispatch desk, Steve has spotted a job.
Sorry, I'm going to send you out on this. M62 near goal, car roll over, then gone through a fence.
Paramedics Paul and Rachel are racing east to the scene of a serious motorway crash with Dr. Chris.
What are we going to? M62. But what crash? Yeah.
Roll over into a fence. On the way to the job, the only information we were given was that the car had come off the motorway at about 70 miles an hour. It did look like it wasn't going to be a particularly pleasant job.
From the Nostell Airbase, flying time to the crash is 8 minutes.
Steve's just tasked us to a job on the M62 near Goole. The reports of a car that's been in a collision and left the carriageway. Statistically, motorways are probably the safest roads to drive on, but certainly if they lose contact with the road and end up coming off, with the speed there can be some pretty serious injuries.
5 people die on Britain's roads every day, and more than 70 are seriously injured. The team are heading to the M62 Transpennine motorway, one of the busiest motorways in the north.
The one thing we have to be very careful around working on motorways is our own safety. You know, things can go from bad to awful, in split seconds, so we'll be trying to make sure that the motorway's closed and having good visibility to make sure that we've identified all the hazards.
En route, the team get an update from Steve on the air desk.
I don't know if you can see the incident, but they're running on a second detail now where it's apparently where the patient is.
Apparently it's an obvious external leg rotation, fractured leg over.
Pilot Gary is circling the crash site. A car has careered off the motorway and ended up on a parallel A road.
Parking on motorway, on the road?
Yeah, just that bush there, that's all. I'm going to be downwind. Good left. 200 landing on. No good. Both jump out the doors. Roger. Okay, cleared out.
When we arrived on scene, we could see the car was a real mess. There was damage to all 4 corners and damage to the roof as well. So that can be a sign that this is going to be a pretty serious incident.
Their patient is lying in the road by the wreckage of her car. Passing motorists stopped to help and stayed with her.
Hello, sweetheart. I'm Rachel. I'm one of the paramedics, OK, and this is Dr. Chris. What do we call you?
Gabby.
Gabby, and do you know what's happened, Gabby?
No.
All right, sweetheart. All right, sweetheart. Do you remember what happened?
No.
Yeah, she's come off the motorway over all the grass and onto the road.
Did you witness it?
We got here just after the car was here. Gabby had got herself out.
I know, sweetheart.
19-year-old Gabby Clarson's car smashed through a fence and rolled several times before coming to a stop more than 100 yards away.
At the moment, can you just feel the pain in your leg? Have you got any pain anywhere else?
My stomach.
Your stomach. Can I have a feel down the back of your neck? Have you got any pain in your head?
No.
Any pain in your neck?
No.
Any pain down the back of your neck?
Well done.
No.
Down your back. All right, sweetheart. Have you got any pain round here?
No. My hip on my right.
The hip on your right. This side?
Yeah, look, when you push on it.
All right, sweetheart. What about this side?
No.
OK, and I'm just going to have a quick feel of your tummy. Any pain there?
Yeah.
It's not clear whether Gabby was flung from the car as it rolled or if she managed to drag herself free of the wreckage.
Can I just come underneath?
I can't move.
Any pain there?
No.
She has serious injuries and multiple fractures to her leg, which has rotated 180 degrees.
Tender all over her abdomen, tender on her right hip. She's got an obvious fracture dislocation of that foot. In quite a lot of discomfort, no neck, no back pain, but she doesn't remember anything that's happened.
What do you want me to do for you, mate?
I think we just need to get her up and get her lying in and get her some pain relief because she's in absolute agony. Right, sweetheart, we're going to be coming at you from all angles now. Chris is going to bob a line in you and get you some pain relief. I'm going to do some observations on you and then we're going to look at getting you up off at floor, all right?
Right, Gabby, it's going to be a bit of a scratch on your wrist, OK?
Dr. Chris is putting a cannula in Gabby's arm. She's going to need powerful intravenous pain relief before they move her onto a stretcher.
Just thinking about giving her a bit of fentanyl. You happy with that?
That's probably the best one, isn't it?
Now, Gabby, we're going to give you a drug. It's like morphine. It's a bit stronger and it's a bit cleaner. Doesn't make you feel sick.
So, Gabby, where were you going today?
Home.
Home. Where's home?
Grimsby.
Grimsby. Do you have any medical problems, Gabby? No. And did you feel all right this morning? Yeah? Not been feeling unwell at all today?
No.
Do you mind if I cut your jumper, sweetheart? Right.
No other vehicle was involved. Paramedic Paul is checking the wreckage to try to understand what caused the crash and the mechanism of Gabby's injuries.
It looks like from the damage to the fence that she's been driving eastbound on the M62. She's then, for some reason, left the road and completely gone straight across the grass verge through that fence, and then as she's hit this road, she's rolled a few times, causing the damage to the car. So obviously, if she's had a bit of a blackout or something at the wheel or a fit, and obviously she's caused that, she's going to be travelling at 70 miles an hour plus. So obviously she's very lucky to be in the situation she's in at the minute where she's able to talk.
All her obs are looking really nice. So BP 124/82, heart rate of 100 and stats of 99 on air. So everything else is looking good. Just the ankle and then obviously a good look at her abdo-pelvis when we get her moved.
She had quite a nasty femur fracture, so that's a fracture of the main thigh bone, but also an open fracture of the leg, and that's where the bone's broken and poked through the skin. You know, the risk of that is there's infection there and blood loss or damage to nerves and other vessels.
We're going to need to put it in something while we move her out. Yeah.
The fractures are so serious, the team will need to straighten the leg where she lies.
I'm going to move your leg slightly, but it's going to be really uncomfortable, OK? We've given you some pain relief, but whatever I do, it's going to hurt for the time being, OK?
Grip my hand as tight as you want it. Keep gripping it, keep gripping it. That's it. That's it. That's it.
Oh, it hurts up here.
It hurts up there?
Well done, well done.
Where's it hurting?
At the top. Oh, my God. Please stop.
Are you allergic to anything, chick? You're not allergic to penicillin or anything, so we're going to give you an antibiotic. Right, sweetheart, this is going to be uncomfortable again, OK? But what we're going to do, we're going to get this board underneath your legs, then we're going to slide you down it, all right, rather than moving you about.
OK, ready?
Are you ready?
Ready, slide.
Oh, my God.
Keep that leg straight.
I'm trying.
Take that leg
Oh, come on.
Right, so lie you down flat, ready?
I can't.
OK.
Hurting my hips.
Right, sweetheart, I need you to lay down on that. I know it's...
Really hurting my hips.
Come here, squeeze my hand, mate.
Paramedic Paul has the difficult task of calling Gabby's mum to inform her.
Your mum says she's going to come down to the hospital and see you.
And she loves you.
That's pretty hard, you know, ringing somebody out of the blue and telling them bad news. Often people be at home worrying, wondering if something's happened. You know, their loved one may not have come back on time. So sometimes having some news is better than having no news.
Right, we're going to move your leg again, sweetheart. Just bear with us. You're doing really well. This might help relieve some of the pain, all right?
Right, I'm just going to just gently pull your leg, OK?
Using force and a Kendrick splint, Dr. Chris is pulling Gabby's broken leg straight.
Squeeze my hands. Squeeze my hands. Yeah.
He's done it. Gabby's leg is realigned, reducing the risk of internal bleeding from her fractured bones.
So the painkillers that we're giving you, sweetheart, will reduce your pain, but it's not going to take it away. The only thing that'll take that away is once you've had an operation, OK? So we've just got to make you comfortable. I'm going to leave your hat on as well, because, one, it looks cool, and two, it'll keep your head warm, yeah?
Ready, steady,
Gabby's made this journey home many times, but today, something happened to cause this crash. The passing motorists who stopped to help are shaken.
It was a complete shock, yeah. We were just talking about getting home and walking the dog. It's not what we expected at all. The gentleman wasn't local, he was calling the emergency services, so he didn't really know where we were. So I took over that call and sort of got the location to them, and then my wife is trained first aider, so she was just keeping her company and making sure she was okay.
You're doing really, really well, Gabby, all right?
With this patient, we just needed to load and go. She could have had hidden injuries. She could also have had a medical event that caused the accident. So the best place for her was hospital.
They're going to fly her 20 miles to the Hull Royal Infirmary.
Is it still really sore? Yeah. So we give you a little bit more painkiller, and then we're going to give you another drug, OK? And the other drug is an antibiotic.
Hi, love, is that Hull? Hiya, it's Rachel calling from Helibed 99. Hiya, we're wanting to bring to you a 19-year-old female who at 14:25 was involved in a high-speed rollover from the M62. So injury-wise, she's got a high fractured femur and a fractured left ankle. She was on the M62 doing about 70, and she's come off the M62 up the embankment and then onto an A road where she's rolled. Yeah, she's not sure as to why she's come off the motorway though. She's got no recollection of that.
7 Golf Tango into control airspace, radar control service.
At a flying speed of 160 miles per hour, it's just 9 minutes to the major trauma centre at Hull.
OK, guys, ready, and slide.
Gabby is lucky to have survived the crash. Only scans by the waiting trauma team will reveal the full extent of her injuries. She'll need surgery, and she could be months in recovery. At Nostell Air Base, Helibed 99 is being scrambled to the Peak District.
Autopilot, auto trim, stern in.
Pilot Jeff has paramedics Rachel and Matty quickly airborne. They're being called to a man who's fallen 20 feet off a cliff edge.
We have just been activated to a gentleman who's apparently fallen whilst out walking. We don't have a lot of information. It is down towards the Peak District, so it's just over our border into Derbyshire.
The update is that somebody's fallen. It's all a bit vague. I'm not quite sure who the call's coming from. It's a fallen walker below Robin Hood Cave.
Roger, that's all copying, mate. We've got 2 minutes out. I'll call when we land in.
It looks like it's nowhere near the road, doesn't it?
Mountain Rescue are also racing to the scene, but the teams have no precise location for the patient.
It's that cliff, isn't it? It's a cliff all the way across there.
The helicopter is circling the Peak District's famous gritstone escarpment, Stanage Edge.
If he's fallen off that ain't 10 metres. The area where the patient was a cliff area with lots of rocks and fallen rocks. Potentially, if somebody's fallen from that, they would have really significant injuries.
Is that a MRT there, red top, with a yellow bag on?
I don't know, because they don't look to be with.
It looks like there's people climbing all around though. They've got flurry stuff on us, haven't they? So if you go right of that, there's more people. But yeah, I bet it's one of them that's fallen.
Their patient has had no medical care. Rachel and Matty know they need to find him fast.
Go good on left, mate. Air desk from 99, we've landed at sea.
When we landed, we couldn't see where the patient was. It was a really big area and there was quite a lot of area to search. So because we couldn't find them, we ended up just having to get out and go look for them on foot ourselves.
So where do you reckon he is, over that way?
MRT are saying they've already got to him.
It's a long walk to the injured man and slow going over dangerously rocky ground.
They're up there, aren't they? Ah, he's over that way.
A quarter of a mile away, Mountain Rescue have begun treating the patient.
Hi. Is it stable? Hello, sweetheart. Well, I'm Rachel, this is Matty.
Hi, mate. Paul was doing something incredibly epic up there.
He was sending it to the extreme.
49-year-old Tom Brunt was climbing the rock face when he fell 20 feet and landed on a large boulder.
Complaining of discomfort in left butt cheek, top of pelvis. So we have popped the pelvic binder on, popped him in the backpack, and we just about to take him out of it.
Yeah, okay, fair dues.
The thing is, I noticed his pupils are a bit small, but he wasn't wearing a helmet. He said he did knock his head, but he's not complaining.
But he hadn't had any head, and you can't see any head injury that you're aware of.
Tom's pain could indicate a fracture.
Right, well, my colleagues are sorting out how we're going to get you down, young man. Am I all right to do your blood pressure and a few other quick checks just while we've got a couple of minutes? Yeah.
Tom and his friend Royston are veteran climbers with 30 years' experience.
Tom fell from Robin Hood's buttress direct. He was trying to stand up, his foot slipped, and the nut he placed, which is a nut I've placed many times myself, ripped out of the rock, and he fell and hit his pelvis. It was possible that he'd hit his head on a rock. You're always worried about head injury, that's the main thing.
Brilliant. 134, 974. Right then, young man, let's get you down off this hillside, eh?
The helicopter was on top of the hill and we didn't want to go back up there. So the mountain rescue guys helped package the patient and get him down the hill safely.
Medic 2 to pilot.
Yeah, go on, mate.
Yeah, mate, MRT are going to be ready for you down bottom.
Rachel is arranging the repositioning of the helicopter to flat ground below. It's closer to the patient, but Tom still needs to be carried there.
We're all good to move?
Yeah, fine. Ready on you guys.
He's got a left-sided hip injury, maybe a pelvic injury. It looks like he's fallen quite a significant height.
If Tom's pelvis is fractured, it can cause life-threatening internal bleeding, and he'll need careful handling from Mountain Rescue to get him over this rugged ground.
Just a good job Mountain Rescue here, because I don't fancy mine or Rachel's chances of lifting him back up to aircraft.
Across Yorkshire we've got lots of different mountain rescue teams and they are absolutely amazing. They're all volunteers and they really help us out when we need it, when we've had patients stuck in the middle of nowhere and nowhere near a road. Oh yes, we've got a helicopter, but sometimes it can still be a long walk to them. So we really do rely on them to help manoeuvre patients to where we need them to be.
We'll have a quick look at him, make sure nothing's changed.
It is now 2 hours since Tom's fall. Rachel fears he could deteriorate at any moment.
Right, sweetheart, I'm just going to lift your top up and go up your top, and then I just want you to take some nice deep breaths from me if possible.
That's 99, pulse 48.
Yeah. I'm just going to have a quick check and make sure there's no bruising or anything coming up. I can't see anything. There's nothing obvious. There's nothing obvious in his groin.
All right, mate, it'll be a sharp scratch. Keep nice and still for me.
Shall I draw some TXA up?
They're giving Tom TXA, or tranexamic acid. It'll help stem any internal bleeding until they get to hospital.
Is anything changing? Because you look like you're grimacing a little bit more than you were before.
No, not really.
It's time to fly.
Head first into there.
And lift.
How are you feeling, my love?
I'm feeling okay, just a bit sort of a little bit shivery.
Yeah, okay.
Hiya, mate. Our ETA to Northern General will be 10 minutes. That is 10 minutes, over.
9 minutes, guys in the back. Oh, mate, iPad's away. I've got eyes out.
I like the outdoors, but doing this job's made me more aware of the dangers that are involved. Safety is paramount. I don't just go rushing into things like I maybe would have done.
It's just a short flight to hospital in Sheffield, where a full trauma team is ready and waiting to take over Tom's care.
I'm going to stick it over there.
Are you still feeling really cold?
Oh yeah, I just feel a bit wobbly and a bit shivery.
His injuries are serious, and his climbing days may be over.
Guys, shall we go to Wakefield?
At Air Ambulance HQ, Matty is listening in to a painful 999 call.
I can't speak.
A man has fallen doing DIY at his home.
Yeah, I think we should.
In under 5 minutes, Matty is on board HeliMed 99 with paramedic Andy and Dr. Paul.
Radios and lights. Radios and change lights on. Autopilot. Engaged. Auto trim. Engaged. V21 departure out of here, going to the west.
It's a short flight for the team.
So bloke who's fallen off a ladder who's got quite bad difficulty in breathing in background.
Okay.
Sounds like he's got a nasty chest injury.
So where the address was plotting, it looks like there's some fields out to the east. We can break through one of those gardens to get to the address, potentially.
Alright, you got the M1, 30 seconds out. Is there an ambulance? Looks like an ambulance there.
There were 2 allocated.
Oh, yeah, seen you. Yeah, that's got to get it.
Every year, over 40,000 people are admitted to hospital after falling from a ladder.
Happy?
Yeah. There might be a gap to 1 o'clock, Matty.
Okay, mate, we'll try up that way. Cheers, pal.
In 69-year-old Les Swift's home, local paramedics are giving him oxygen after a stepladder snapped and went from under him.
Les, I'm Matty, this is Paul, you've obviously met Julie already. Can I have a just quick check over you, is that all right, yeah? You stick your tongue out for me? Good man, taking a nice deep breath for me? You can't, all right mate, I'm just going to have a quick touch on your chest, okay? You take a breath for me?
CCTV captured the moment Les fell 10 feet to the concrete floor while clearing out a carport.
Paul?
Yeah?
You get IV access for us, mate, and some
I'm on it.
analgesia here. What we're going to do is we're going to pop a needle in your arm, I'm going to give you some strong pain relief, help you with that breathing, OK? Is this fresh air helping that my colleagues have given you?
A little bit.
OK. Any pain in your tummy at all?
It looks like Les broke several ribs in the impact.
Guys, reduced air entry on the right base, good air entry on the left. A little bit difficult to auscultate just because I think he's struggling with the pain. A little bit of bruising on that right-hand side, couldn't feel any crepitus. So, plan is, sir, give you some strong pain relief, that'll help you with your breathing, and then we'll be taking you off to hospital, OK?
Les was alone when he fell, but managed to stagger into the house to tell his wife.
Les, I've just given you some very, very strong pain relief, OK? When we get in the ambulance, I'm probably going to give you some more medication as well, all right? You're on a blood thinner. You've taken quite a whack to the right-hand side of your chest. You've got some other organs under there that we'd be a little bit worried about. So we're going to come with you in the ambulance to hospital, OK? But we're going to look after you. Julie's going to look after you. Me and Paul look after you as well, OK? But I think if we lay you down flat, it's going to make your breathing a bit worse. So it's just going to be a bit of a trade-off, all right? So I think we'll try and keep you sat up as best we can, but we just need to be mindful of any other injuries. All right, mate?
Matty suspects Les has a punctured lung, and he may be bleeding internally.
Should we give him some TXA in the DCA? Yeah, do that en route. Any questions at this point? Yeah, OK, we'll do that, OK? Your cat's very well behaved.
Oh, yeah.
Matty is trying to keep Les calm, but his oxygen saturation levels are falling fast.
50 mics of fentanyl. We're going to give him some TXA and some more in DCA. Got right-sided chest injury, queer a bit of liver underneath. Low sats, reduced air entry. 93. OK. There we go, my buddy.
A simple DIY task has left Les with serious injuries.
Okay, we just steady roll.
He's going to hospital by road so he can be kept upright on the journey.
So this young man's fallen and he's got a significant right-sided chest injury. So the local hospital to here is Pinderfields, but that can't deal with major trauma. So we're going to bypass that and go to Leeds General Infirmary, which is the nearest major trauma centre. So he'll get some more specialist interventions when we get there.
Injuries-wise, he has got reduced air entry on the right side, probably some rib fractures, plus or minus pneumothorax, maybe hemothorax. All right. See you later. Cheers.
How are we doing with that pain, Les? Ready for some more pain relief? I'll just give you a bit more, yeah?
It's been a distressing morning for Les's wife, Valerie.
Les, just let your other half know that you're all right, OK. It's not the pain in your chest, it's the telling off you're going to get when you're back about being up that ladder. Right, I'm going to shut you in, Les, all right? You happy if I go to the front, mate? Yeah, cool. All right. He's fine. He's OK, my love. All right. Like I say, he's got this chest injury. He's a bit better than he was before, isn't he? He's chatting away. He looks in a bit less pain. OK. We'll get him sorted. OK. All right.
Thanks very much.
All right. Okie dokie. See you later.
Paul and Matty will travel with Les. There's a strong chance he could deteriorate en route. He needs hospital care. Fast.
Ambulance service, is the patient breathing? Okay, tell me exactly what's happened.
It's a freezing cold day, and Yorkshire's ambulance service is stretched to the limit.
Are you with the patient now?
Okay, I'm organising help for you now, so stay on the line. I'll tell you exactly what to do next.
This might be one for you folks. Lancet reservoir, so it might be an access issue.
On the air desk, dispatcher Dave has spotted a job that could use the air ambulance.
They've said they're a mile from anywhere, and it looks rather steep, so helicopters going from here.
Autopilot is engaged. Flash trim. It's staying. Advisor down. Yeah. Brief. Roger.
Paramedics Matty and Kit are heading for a remote stretch of moorland in South Yorkshire's Peak District. On board with them is Dr. Neil.
We have been tasked to a male mountain biker who's come off his bike on a remote moorland bridleway towards the north edge of Lancet Moors. So he's awake and talking, but he's got a back injury.
Flying at 160 miles per hour, Helimed 98 will be at the cyclist's side in just 8 minutes. They'll be the first medical team there.
Mountain Rescue are very proficient and active in all of the sort of rural locations, but it takes them a time to mobilise, and they're predominantly walking from the roadhead to scene, so it can be an hour or two before they can get on scene.
On the air desk, Dave is coordinating rescue teams.
I've spoken to comms about a vehicle to back you up. At the moment, they've got 20 outstanding emergencies that they can't cover.
Yeah, Roger, no worries. We've got an ETA of 6 minutes. I appreciate the stacking calls, but we might need backup.
Their patient is somewhere in the vast expanse of cold and exposed moorland below. Luckily, pilot Jeff knows the area well.
I think it's going to be on this path here.
Yeah, visual.
Just there. It
will be a tricky landing on uneven, heather-covered ground.
I'm watching the tail. You just open that door, kit, and just make sure that's see what if this kit's skid on the right sink excessively. Go down. How's that look? Looks good. Thank you very much.
Hello. The biker's worried brother was cycling with him when the accident happened.
His lower back that he previously bumped before. Is it Richard?
Yeah.
How are you doing? Kit and Neil.
It's my lower back that's hurting.
I'll go and get shelter. Okay.
41-year-old company director Richard Campbell is in a lot of pain. He was doing 30 miles an hour on his electric bike when he came off on the rocky track and landed on his back.
My front tyre went one way, my back tyre went the other, and I came off and I think I smacked my back on the actual lump itself, my lower back.
It's late afternoon and temperatures are dropping rapidly. Richard has been lying injured on the freezing moor for over half an hour.
We need to prevent him getting cold because patients exposed to elements don't tend to do very well in trauma. So they're trying to get him nice and warm, get him packaged.
Dr. Neil will check him over under a temporary shelter.
Any tingling, numbness, pins and needles?
Just my back hurts.
But it's not going down your legs now?
No, I've not got no shooting pain. It's just a really dull pain in my back. I'm glad I didn't hit a rock, but it was as bad as it could have been.
Well, what we're going to do is wrap you up, get you warm, and get you off the hill.
Perfect. Let's do it quick.
Rocket science.
Let's do it.
All Richard's symptoms point to a worrying back injury. Kit's giving him gas and air for the pain.
If you've ever been scuba diving, it's just like one of those rigs, yeah? Right.
If Richard's core body temperature drops by just 2 degrees, he'll be at risk of hypothermia. The team need to work quickly to get him off the moor.
How are you doing, Ray?
I'm all right. I'm not. I'm in pain now.
With perfect timing, the local mountain rescue team have arrived.
Hello. We're ready to carry now, if we've got enough people now.
Richard is wrapped in the team's Flectalon, a high-tech bag designed to capture body heat and quickly warm up the patient.
All right, straight over the bog to the helicopter.
Wheel right a bit.
Go around that way.
Yeah, nothing there down to you. Mike November 02, ordered leader receiving over.
Richard cycles these moors regularly, but today his ride is ending with a short flight to the nearest major trauma centre.
Because of the slope, and because of the nesting birds, we'll do a vertical.
By air, it's a smooth 5 minutes to Sheffield's Northern General Hospital.
Good on the left.
Roger. Weather's more or less the same as it was last night as well. It's going to stay more or less what we've got now.
The team are regularly called to mountain bike accidents.
I picked another mountain biker off the same track, but he was right at the top. Every little helps and all that.
We've only got a couple of minutes out to Northern General, mate.
Everybody locked and tight?
Aye, sir.
Yes.
I can see high-vis people.
Yeah.
Richard will soon be heading for scans to his spine.
Oh, good left, mate.
To avoid worsening his injuries, a specialist trolley will smooth out any bumps on the way into the warm hospital.
Do you want me to pull the other end?
His injuries are serious. They may be life-changing. A low wet weather front is sweeping across Britain's biggest county. The Yorkshire Dales are shrouded in mist.
Radios and lights.
Radios will do once airborne lights are on.
Flying conditions are not ideal, but at RAF Topcliffe in North Yorkshire, paramedics Lisa and Gemma have an emergency.
Good left.
We'll lift into hover and I'll probably just turn around. It looks like there's no wind at all, so I'll just go left up the taxiway.
Okay.
The weather on this particular day was really grim. It was grey, it was cloudy and it was rainy. We weren't even sure if we were going to get to the scene of the incident, but it's always worth setting off because there might be a chance that we can land.
35 miles away in the Dales, a motorcyclist is lying injured after coming off his bike.
We think he was travelling at 60 miles an hour, so that's quite a significant speed to come off your motorbike, and we don't know if he's hit anything when he's come off. It could be a wall, it could be another vehicle, so the potential for him to be quite injured is there, so we're going to go and fly along and see what's happened.
The team are racing to the rescue at a pub in remote Swaledale, but the weather could have other ideas.
The Tanhill Inn is known for being really, really out of the way. It's a pub high up in North Yorkshire, so on a normal day, if the ambulance service is busy, there might not be an ambulance very close by to this gentleman, so with the helicopter we can get to him really quite quick and hopefully get him sorted out.
But the team are flying on the edge of strict weather safety protocols. If it gets worse, they may have to turn back.
Right, okay, the weather's starting to close in a bit. The issue I've got is I'm worried I can't get over the ridge, that end of the ranges. Yeah. The cloud above us is really quite thin. There's blue sky just above us. Right, so my escape option at the moment, now, Lisa, is to go up.
Okay.
You happy?
Yeah.
Any moment now, we're going to break out of this.
Getting brighter, isn't it, again?
That's at 2,000 feet.
There we go, nearly
there. Come out at the top any second.
You're out on the left.
Right, we're out.
Yeah.
But I don't think we're
going to get down.
They've made it through the cloud. The challenge now is how to get back down. To get to their patient, Harry needs a break in the cloud cover so they can safely descend.
This is so thin, this bit here.
Yeah. Is it thin enough to go through it? You can't see how thin it is, can you?
Not until I can see the ground.
No.
I need to be able to see the ground.
There might be a hole, Harry, at 8 o'clock.
Right, okay.
If Harry can't find a place to descend, they may have to abort the patient rescue.
We're now in the valley to the north of the Tan Hill, basically. We're 1,600 feet above the ground.
There's a hole here, Harry.
Yes.
Nice big hole.
Yes, I can see the ground. So we're going to run in, down the hole, and descend through it.
Right. It's good my side now.
Yeah, looking at this side. Right, so I'm flying directly towards it. We're 2 miles away from the pub at the moment.
At last, the team are through the cloud.
Let's see what we can find around here. Trying to find somewhere flat enough, is it?
Yeah, it's all a bit slopey, isn't it?
I've got a bit sort of coming up now. I'm going to give about another 10 yards or so. Just going to give that a try.
It's a bit slopey, isn't it?
No, it's not too bad.
Okay.
So about 4 degrees, 6 degrees nose up, well within limits. Happy days.
Lovely, nice one, Harry.
ADS 98, we've landed C.
In the middle of the rugged Dales, the remote Tanhill Inn is Britain's highest pub and prone to the worst of Yorkshire's wild weather.
Hi.
Came off his bike a couple of miles away.
Okay.
Got into the back of a car.
Right.
Brought here.
Yeah.
He's then sat here, not moved since.
Okay.
61-year-old biker Robin Brown is in the care of local paramedics who've just arrived.
No loss of consciousness, remembers everything that's happened.
Yeah.
Left-sided chest wall pain, very tender over his sleeve, and reduced air entry on the lower left.
Okay.
Robin is an experienced biker. His mate's dashcam captured the moment he was catapulted into a roadside ditch at 50 miles per hour.
How does that breathing feel, Robin, now?
It's just shallow, I just can't...
Just because you can't take a deep breath because it hurts?
Yeah.
Yeah, okay. Is that where it's sore?
No, I don't. It's across the front, but it's sore.
Around there. How did you land? Remember?
I went head over heels.
You didn't fly very well?
No.
Robin is putting on a brave face, but he's had a terrifying experience.
What caused you to come off your bike?
I hit a gully on the right-hand side.
Robin's internal injuries could worsen, but with the weather closing in again, the team face a dilemma about whether to fly him to hospital or travel by road ambulance.
It's an hour and 20 to James Cook. I've just Google mapped it. It's not far.
No, I didn't think it would.
And it's an hour 55 minutes to Darlington.
And we're 20 minutes away, aren't we? But we'll have to get a shift on if we're doing it. Okay. So what we've said is we can fly, but if we're flying, we need to go quite quick because the cloud is just on the limit for us being able to go.
Thank you.
We see loads of motorcycle accidents working on the air ambulance. Often they're at really, really high speed and patients don't get away with it. In this situation, because of the protective equipment the patient was wearing, that undoubtedly saved his life.
Where's all that cloud gone?
There's still plenty on the nose.
As the crow flies, it's 38 miles to the major trauma centre in Middlesbrough.
ADS 98 with lifted route in James Cook. Would you just shout the DCA? We just asked them to hold off in case we have problems lifting due to weather, but we're happy for them to go now.
The weather must hold for the 16-minute flight, or the team will have no choice but to divert to another hospital further away. Finally, after a tense flight, there are blue skies over Middlesbrough. This journey would have taken well over an hour by road.
Does your breathing feel okay? Does your
No.
breathing feel normal?
It don't feel normal.
It doesn't feel normal. In what way is it not normal?
Well, I can't breathe.
You can't take a deep breath?
No, I
Is
can't.
that because it makes it hurt?
Yes.
Yeah, okay.
Robin is heading for scans and possible surgery. For the air ambulance team, it's another quick turnaround to beat the weather and get back to base.
Can you just feel the pain in your leg? Have you got any pain anywhere else?
Investigations revealed a tyre blowout at 70 miles per hour caused Gabby Clarson's car to veer off the M62 motorway and roll several times. Today, the 19-year-old has only patchy memories of the crash.
It sort of felt like I'd clipped something, and I remember spinning out and flipping, and then after that it's a bit of a blur. I thought that was it. I thought I'm going to die, and I thought I really hope everybody knows that I love them.
Surgeons at the Hull Royal Infirmary took over 9 hours to repair Gabby's multiple injuries.
I fractured my femur, my tibia, fibula, left side of my pelvis. I've now got a metal rod going through my femur. I've got pins going through my knees and my ankles, and then another rod going down my shin. My friends and family have been my absolute world this year. I think everyone's sort of dealt with it in their own way, but also been as supportive as they possibly can.
Gabby spent 2 weeks in hospital, and it was another 3 months before she could walk unaided. She was lucky to survive the high-speed crash.
I would like to say a huge thank you to the 2 ladies that stayed with me, to everybody that looked after me. And people don't have to be that kind. And it's so sweet that there are people out there that were going above and beyond for you. So, yeah, thank you.
Hello, sweetheart. Well, I'm Rachel, this is Meta.
Scans in hospital confirmed experienced climber Tom Brunt fractured his pelvis after falling 20 feet off the rock face at Stanage Edge in the Peak District. The fracture had to be rested to heal naturally, and within 6 weeks, Tom was cycling and walking. He's taken up climbing again, although he's much more cautious.
Taking a nice deep breath for me.
69-year-old Les Swift broke 2 ribs and punctured his lung when he fell off a stepladder during a spot of DIY at his home.
Reduce air entry on the right base.
Les spent 4 painful weeks sleeping upright while the bones knitted together. He's since made a full recovery.
Is it Richard?
Yeah.
How are you doing? Kit and Neil.
An MRI scan revealed Richard Campbell broke his back when he came off his electric bike on a moorland path and landed on a jutting rock.
Any tingling, numbness, pins and needles?
Just my back hurts.
Richard was bedbound for 10 days to allow the fractured vertebrae to heal naturally. He's planning to get back on the bike when he's fit enough.
Came off his bike a couple of miles away.
OK.
Got into the back of the car.
Right.
Veteran biker Robin Brown has vivid memories of the day he came off his motorbike at 50 miles per hour in the Dales.
We was on a road that we'd not been on before. It looked a straight road. Totally my mistake. I misread. Hit the banking, the bike flew up, I flew off. I just flag a car down, get me a lift up to Tan Hill Pub to phone for the ambulance. I did get to Tan Hill Pub, but not the way I wanted to.
Hospital doctors found Robin had a collapsed lung and a broken leg. He was lucky to survive the high-speed impact.
To get rid of demons and everything else, we went up to Tan Hill Pub. 6 months later, the marks where the bike had dug in, they were still in the bankings and everything else.
Robin spent 4 months recovering and is still having physio.
I cannot thank the Air Ambulance enough for what they did in them conditions. Yeah, thank you very much. Really, really appreciate what they did.
They fly in some of the UK's most dangerous skies.
I'm being smashed about as I go into the valley. It's going to be bumpy, it's going to be turbulent, guys.
From high-rise city centres.
OK, committed to land, over the H.
To remote peaks battered by extreme weather.
The top looks to be in cloud. Can you confirm that's the case, over?
The crews of Yorkshire's 2 air ambulances risk their lives.
Gone unresponsive.
It's just gone unresponsive on us.
To save yours.
There's potentially fatalities involved.
There it is on its roof.
Delivering intensive care by air.
Is he breathing? No, he's not breathing.
The cow trampled me and then came back again and again.
No matter how critical the case,
This is the first time anything like this has ever happened.
He's moving his arms around and he's sweating buckets.
however risky the place.
I'm going to get down there quickly.
He's got an almost complete amputation at the right knee.
What's your name?
Doing their jobs with Yorkshire grit.
Hey, this from Medic 2 at the patient's side, however.
Humour.
You might get rest at week off if you're lucky.
What is it, Thursday?
Yeah.
And compassion.
OK, chick, we're just going to get you out, all right? Don't worry, we'll look after you, I promise.
This time on Helicopter ER. A woman is trapped in her car after a serious smash at 40 miles per hour.
Does this hurt? I'm a bit worried that she might have got a pelvic fracture.
The team fight to save the life of a golfer in cardiac arrest.
You collapse on the golf course, sir.
It looks nasty.
And a pensioner crashes her car into the side of a house.
She was trying to reverse to turn around, and we think she's just missed a gear.
At Air Ambulance headquarters, the siren is sounding.
Beach radar, good afternoon, Helimed 98 Alpha.
Pilot Lee has Helimed 98 airborne to a serious crash in North Yorkshire.
Nothing, H145, 5 on board. En route to an incident to the north and east of Linton on Ouse.
And fits with where we're off.
On board are paramedics Kit and Matty, and Dr. Sarah.
Have we got any clinical information?
RTC persons trapped.
Details are still coming in.
All I know is we're off to Slingsby. We're going to an RTC. It's a very fast road. We don't entirely know what's happened at the moment, so there's no crew on scene. They're going to get there in about 9 minutes, and we're due there in 12 minutes, so hopefully we'll get an update beforehand.
Matty is already thinking about getting the trapped patient to hospital.
So looking where this is, right?
Okay.
We're probably smack bang in the middle between Leeds, James Cook and Hull. Hull secondary transfers, I think we can rule that out if they're going to fly anyone.
Yeah.
So Leeds or James Cook.
Okay.
From 300 feet up, they've spotted the crash site.
So it's going to be one of these fields. I'm looking at one of these to see if I've got a gap somewhere. A little bit of a gap there, isn't there? Okay, so the little gap's in the right 1 o'clock now. That's your exit, as it were.
See.
All clear on the left, buddy.
All good this time,
Lee is landing in a field close to the crash. Police have closed the road.
Okay, clear out.
On the ground, fire crews are battling to free a woman trapped in the wreckage of her car. Local paramedics bring Matty quickly up to speed.
So we've got Viv in the little red car and a gentleman in the Enterprise van.
Okay, buddy. Any major concerns at the minute?
Viv is complaining of 9 out of 10 abdo, hip, pelvis pain.
Okay.
Lower back pain. She's normally fit and well, has no allergies.
Okay, mate. I'm Matty, this is Sarah.
This young lady is Viv, 55-year-old female, driving at normal road speed when she's fired into this other car.
Viv Crozier is in a bad way. She is conscious, but pinned by crumpled metal.
She is complaining of back, chest, pelvic and abdominal pains and pain in her right ankle, like where it's hit the pedal.
The pedal. Okay, mate.
She's struggling to move it. Says that the right knee is hurting as well.
Okay.
Viv has multiple injuries.
Any loss of consciousness at all?
No loss of consciousness reported. She has no past medical history, takes no meds.
All right, lovely. If you want to start on with that then, mate, what we'll do is I'll get the stretcher off for DC and then we've got a way of getting her out as soon as we... Is that all right, mate?
No problem.
Her car has smashed into the side of a van at 40 miles per hour. She didn't have time to brake when it pulled out of a junction in front of her.
Lovely.
Two cars have collided. This car is quite significantly damaged. It's such a small car, but it's done a great job. It's crumpled and the airbags have gone off. But the lady who's in there, she's alert, able to talk to us, but she's complaining of a lot of pain in her pelvis and her hips. And because the car has pushed back into her, I'm a bit worried that she might have got a pelvic fracture. So we're just allowing fire to extricate her from this vehicle, and then we'll get her up onto the scoop and we'll have a really good look and then decide where we're going to go to from there.
Viv needs to be cut free. The fire crew's jaws of life, hydraulic metal cutting shears, are making short work of her car. In a second ambulance, local paramedics are treating the injured van driver.
Hi, I'm really sorry. I'm Matty, one at Helimed Paramedics. You guys all right? Have you, got any major concerns? Are we okay to deal with the other lady? Yeah? All right. Sarah, it's 45 minutes now since time of injury and she's still quite stable, isn't she? So let's not rush things out for a minute if we can get her out properly then.
Fire crews are preparing to slide Viv out of the wreckage onto a rigid board. She may have spinal injuries, so they need to be careful. Any sudden movement risks paralysing her.
Just before you move her, can I just ask her something? Don't look at me, keep you looking in the direction you're looking. Okay, I'm Sarah, I'm one of the doctors. Viv. Can I just ask before we just move you, does it hurt in here?
Dr. Sarah is checking for signs of internal injuries.
Does it hurt in here?
No,
excuse me for this, but does it hurt here?
No.
Nothing at all?
No.
Does this hurt?
No.
That hurts?
All
right. I just need to have a quick look, is that all right? Just underneath? Okay, Chick. No problem, we're just going to get you out, all right?
Dr. Sarah's concerned. She doesn't want to waste any time. They need to move Viv.
Okay.
It's vital they keep her spine immobilised while they slide her free. At last, she's out,
Feet this end, please.
and Dr. Sarah can finally examine her properly.
Stop there. Can you keep hold of her head for me, please? Please, will one of you just get a blanket just to cover her up?
All right.
Viv, I'm just going to need to cut your clothes off.
All of them?
All of them. Okay, does this thing hurt? Does this thing?
It looks like Viv has internal injuries.
This thing? This bit? Starting to hurt down there. Okay, no problem.
She's got a good radial, mate. Cool. Right, I'll let you give that and then I'll flush it with TXA.
The drug TXA, or tranexamic acid, will help stem any internal bleeding.
Her belly's really tense, really sore. She's got some crepitus on the left-hand side, mid-chest, and it's where there's an overlying abrasion. The pelvis actually is all right, but we're not going to be able to tell the difference, so we'll still put binder on, put splint on. She's having TXA so she can go to an MTC.
Yeah. You right there, Flower? Yeah. I'm Matt, I'm one at Paramedics. We haven't said hello yet, I don't think.
Is everybody happy? Happy as we're going to be? Yeah. So on roll, ready, steady, roll.
Keeping Viv's spine immobile, they're rolling her onto a rigid two-part stretcher called a scoop, ready for transport to hospital.
Okay, and down, ready, steady, down. Okay.
Viv's son has raced to the scene. He's understandably worried.
Think she wants you?
Right, guys. Oh, feel a bit of discomfort, sweetheart?
All right.
Well done, my darling.
Okay, right, let's get her onto here and then we can lift her and... Yep.
Ready, steady, lift.
Dr. Sarah is concerned for her patient.
I've taken all of her clothes off and had a really good look, and she's got bruising to her chest wall here and it's really sore. But she's able to breathe quite freely, which is great. And she's complaining of lots and lots of pain in her tummy, and she's got a bruise along the bottom of her tummy, just where the seatbelt fits in. So I think as she's crashed, that's really pulled into her, and it's hurt her. So whether that's anything significant inside her tummy, I really don't know. That's going to be a scan that tells us. So we're going to have another quick look at her observations now, and then make a plan about whether we need to fly her or whether we need to drive her to hospital.
In the ambulance, Dr. Sarah can examine Viv more fully.
Does it hurt you to take a deep breath? It does hurt to take a deep breath. And is that because of this pain in this side of the chest? It's all in the belly.
So here, the bottom.
Okay.
Better than it was for.
Okay, but it's...
Pain relieve's helped that my colleagues give you? Yeah. Gav, yeah, just a quick update, mate. We can't rule out any internal bleeding, and we think, given the fact it's over an hour to any NTC, we're going to fly her to LGI over.
Viv's condition is serious. She could rapidly deteriorate. The team will fly her to hospital immediately.
Before cars had all these crumple zones, all that kinetic energy would have just gone into the patient, and I think she would have died. So I think all the modern technology that goes into making cars of today are just lifesavers. It never ceases to amaze me that some people can walk out of a car that's completely destroyed. It's a shock. You can never be too sure what's going to happen to somebody.
Now, keep now.
Bridges lights.
There's no change lights.
Autopilot.
Engaged. 3, 2, 1 out.
Visors and brief.
3, 2, 1 out of here.
Viv is lucky to be alive, but she isn't out of the woods yet. Dr. Sarah will monitor her throughout the short flight.
She's had quite a lot of morphine. She's still in a huge amount of pain in her tummy, and to feel on her tummy it's very solid. So I'm still a little bit concerned that she may have bled inside of her tummy, and to drive all the way up to Leeds would take well over an hour, whereas we can get there in just 15 minutes in the aircraft.
Pilot Lee is heading 35 miles to the tower blocks of Leeds city centre.
See if I can get the helideck now, and it'll just be a standard approach, pretty much on the nose actually, onto the helideck.
They'll soon be touching down at the Leeds General Infirmary's rooftop helipad.
It's got a bit of a crosswind there, but I'm happy to accept that. Coming into land, speed's good, height's good. Look at that, didn't even go into transients. There we go.
A full trauma team will take over Viv's care now. She's heading for scans and surgery. she could have life-changing injuries.
Ambulance service, is the patient breathing?
Yorkshire's emergency call centre handles 1 million 999 calls a year.
Is the patient conscious?
Tell me exactly what's happened.
Call handlers can give vital emergency advice until paramedics arrive.
I'm going to tell you how to do chest compressions, make sure he's flat on his back on the ground.
In South Yorkshire, a golfer has had a heart attack.
Place the heel of your hand on the breastbone in the centre of the chest, right between the nipples.
In case of cardiac arrest, CPR can double the chances of survival.
1, 2, 3, 4. 1, 2, 3, 4. I want you to just keep going. You're doing really, really well.
At Nostell Air Base, dispatcher Andy is scrambling the team.
Cardiac arrest on the golf course.
I've got on to stretcher. Oh, boys, scared of that. Boys, go fast.
Paramedics James, Al and Dr. Brian are racing to the outskirts of Sheffield, where the golfer is lying unconscious on the fairway.
We'll go out to gas and just go out to the north with a left turn out en route.
Helimed 99 will be there in just 7 minutes. On the golf course, other players are desperately trying to resuscitate the patient.
When we get there, we'll decide whether we're going to go to a local hospital or to a coronary cath lab, because this is usually a sign that there's been some blockage in the vessels supplying blood to the heart, which need to be unblocked as soon as possible. As you can see outside, we're still dancing in between the storms. There's a possibility of this getting very, very wet.
Once on the scene, the team will try to restart the patient's heart with a massive electrical shock.
Can you defib somebody in a thunderstorm?
Apparently you can defib somebody in a puddle, as long as their actual chest is wet. My eyes are red.
Gotcha. Look at that, that's wet.
It is, but looking out the front, it looks good, to be fair. It's probably better that the showers are here than where we're going. It looks like it'll be all right where we're going.
Less than 1 in 10 people survive cardiac arrest that happen outside hospital. With every minute that passes, the patient's chances of survival drop.
Got some pre-landers, Jeff.
Is everyone locked and tight?
Yeah.
I'm happy, mate, if you are. See the DC on the fairway, mate, out on the right.
At last, the team has sight of their patient.
I'll go for the gap between the trees out in the about 100 yards in front of them, and then I'll taxi back.
Okay.
I'm going to bring the tail round to the left.
Yeah, it's quite steep, isn't it?
I'm going to stick the tail about there.
Pilot Jeff has landed his team just 100 yards from their patient.
Hey, Jeff. Hey up.
Local paramedics bring Dr. Brian up to speed. 3 minutes ago, they restarted the patient's heart.
Hi, yeah. How are we doing? Good, thanks.
So we've got John, 50-year-old male, witness cardiac arrest, excellent bath on the CPR, VF, 1 shot. My arrival, GCS 3, not breathing, now with GCS 15.
Right. 64-year-old John Anderson collapsed during a game of golf. His heart is beating, but he's critically ill.
Who's got pain in his back?
Right, so what we'll do is we'll just put the top on over here, and then we'll get the auto pulse underneath them. We're not going to use it, it's just going to be just in case, alright?
Al is checking John's heart trace readings.
It looks nasty.
Well, the big question is whether he needs to go to sleep or not.
It's not good news.
And skimming hard as well, so the do being slowed down. Yeah.
The retired farrier's restarted heart is racing.
Is there any morphine or bedazzler? No, we're just doing some morphine up now. Yeah. You remember what's happened? No, okay. So what we're going to do, in a second, we're just going to sit you up slightly and put you on like a hard board.
So, ECG at the minute shows that he's got some areas of his heart that have got lack of oxygen. So basically this gentleman, it sounds like he may have had a cardiac arrest. There's some CPR ongoing, and then obviously we've been called. We've just arrived now. He's breathing for himself now and he's awake. So we'll just see what happens really. It's just early stages. He's just come round, so kind of we'll look at his progression for the next couple of minutes and see what happens.
There's a real danger John could go into cardiac arrest again at any moment.
Definitely got reciprocal changes. Yes. I mean, they can have a right main stem infarction, can't they, with AVR elevation, so, and it sort of looks reasonable amount, but...
It's an old trick to look at the posterior leads, the heart. You just flick it backwards, and then maybe something there.
A blood clot is blocking a major artery in his heart.
Right. Okay.
You stay there, John, okay?
John is in agony. His heart has been deprived of oxygen and is struggling to pump blood around his body.
Pull the yellow handles down towards me. Just pull them.
That's it. They're strapping him into a device called an auto pulse, a machine that will perform chest compressions if his heart stops again.
In a second, we're going to lift you up and get you onto our trolley, okay?
Lift your head up for me. There you go, and down again. A little bit of a pillow, okay? Just rest your head back.
The golf club did not have a defibrillator machine. John's golfing mates performed manual CPR for over 10 minutes, with no response, until the first paramedics arrived.
What have you got there?
This is morphine.
Wonderful.
And then the endoscop's outside. So.
Wonderful, thanks. Just going to give you something for the pain, okay? There we go. You had a heart attack? Yeah. I think your mate saved your life.
Said to him, don't worry, it's only hill we've got around here. We'll be all right, just take your time. Yeah. And then just next minute, he got his club out, he went for a swing, and as he swung, he went over.
John isn't out of the woods yet.
Steady, steady.
The auto pulse will monitor his heart.
Let's rest your head back. Right, so I've got the defibrillator watching the screen, just to make sure.
It will automatically deliver a shock and chest compressions if he arrests again.
Okay, John, we're going to get you onto our ambulance now, okay?
What happened?
You've collapsed on the golf course, sir. So going to let your missus know, okay?
I can't breathe. What's wrong? I can't breathe.
John's condition is critical. His heart was stopped for over 10 minutes. Without his quick-thinking friends, his life would already be over. A defibrillator would have helped.
Who did the CPR bit?
Both of us. Kevin started it with a red on. We carried up and just did it.
You saved his life. Just goes to show that early CPR stuffy.
I've just passed my first aid and all.
I've just done mine.
As a result of saving his life, you could do one thing, which is potentially raise money for a AED down there. 700 quid-ish. Yeah. But no, congratulations, well done.
Brilliant.
Okay.
Thank you. Take care.
John is heading straight to heart specialists at the Northern General Hospital.
The people around him have done a fantastic job. They started bystander CPR, and a gentleman has come round. He's woke up now and he's talking, complaining a bit of back pain, but that maybe signify an acute heart attack with problems with blood supply to the heart. So we've congratulated them on what they've done and encouraged them to get an AED for the clubhouse. If that gentleman was on his own, he'd be dead now, even if we were seen from a distance. It's the early starting of the CPR is the most important thing, and that started straight away as soon as he collapsed, and that's the bit that saved his life.
For a while today, it looked as though their patient may not pull through. He may have suffered permanent heart and brain damage. John will soon be in hospital, and the air ambulance crew can return to base.
Weather's okay, all good. Okay, I'm ready.
Helimed 99 is heading back to base. But now another emergency call is coming in.
We've got a 27-year-old female who's been out riding and a horse has fallen on top of her. She's currently lying face down at the top of the track and complaining of back pain and reduced sensation in her legs.
Pilot JB is diverting to Rotherham. The lack of sensation in the patient's legs is ringing alarm bells for the crew.
We're really close. So we've literally got 2 minutes.
Okay, well, I'm looking at the location. It's next to the motorway.
It's just after this triangle.
Paramedic Sammy is navigating. In the cabin are Steve and Dr. Sarah.
And then it's going to be hopefully on a field or a track.
Roger that.
Did he say that the horse was secure? Not heard anything about the horse.
Right over there, desk. I've just spoken to the caller. She says that you're right above her. She's waving at you. You're circling over right overhead.
Is that someone now down at the 9 o'clock in the school? It's like a riding school? Down at your 3 o'clock now, JV?
Yeah, they look like there's someone laid down now. But in
It's not on the track, that's in the riding school.
Yeah.
Is that a body? Yeah, it's her.
The red jacket.
Yeah, it's that red jacket, right. Well, I'm going to go land next to that. Yeah, I'm not going to hang around. Moving forward. Confirm the tail's clear?
Yeah.
Okay, landing on.
Oh, looks good.
Right, levers down. You're cleared out the aircraft.
Oh, hello, my name's Steve.
Falling off the horse, the horse has reared up and gone over and on top of me.
Okay, so whereabouts did it land on you?
Just like the lower part of my back, but both of my legs are hurting.
27-year-old rider Nicole Wayman can't move. The horse she was riding, weighing half a ton, fell on top of her. crushing her back and legs.
Right, Nicola, what I want you to do is, Sarah's got hold of your head. I want you to just answer yes or no when I press was there any pain anywhere. Don't nod or shake your head, okay?
No. No. Yes.
So down there?
Yeah. Yes.
Okay.
I think it's my coccyx.
Okay.
Oh, bless you.
Right, okay.
Steve is checking for signs of spinal injury.
Okay, what about as I feel here?
Yeah, there's pain there.
pain?
In my right hip.
In this one here?
Yeah.
Okay. And can you feel me touching you at the moment?
Yes.
You feel that?
Yeah.
Okay, and I'm just going to feel down your legs. Any pain down there?
Just like a tingling at the top of my leg.
Okay. Can I ask you to wiggle your toes on both feet? Can you do that?
Yeah.
Nicole's mum is here. She saw the accident happen.
She was schooling a friend's horse round and he just were a bit reluctant to go forward, so Nikki was making her go forward and she just shot up in air and come straight back over on top of her. The usually smaller ones she rides, Nicole. She don't really ride big ones, this was a big one she were on.
What we're going to do is we're going to roll you over up onto like a plastic scoop thing, because you know this shavings on the floor, it's difficult for us to put anything else underneath you. Is that okay?
It just feels really numb at the bottom of my back.
No problem. So when we get you over, we'll have a good look at it. All right. I want you to keep your head pointing towards this shoulder. Okay. So don't straighten it.
The numbness and tingling in Nicole's back could be due to spinal damage or severe bruising. Keeping her spine immobilised, they need to roll her carefully onto a rigid spinal stretcher.
Ready, steady, turn. Okay, and just rest there. Sorry, sweetheart, you okay?
Yeah, I'm fine.
Okay, ready, steady, roll. Okay.
Now you're over, I'm just going to have a little listen to your chest, make sure everything's okay. So breathe normally into there, okay?
Just this bit here, my hips and my
Okay, we'll have a look at that in a second. Okay, we'll get this blanket over, then we're just going to cut into your trousers, sweetheart, okay?
Yeah.
It's a sunny afternoon, but the temperature is dropping. Nicole is getting cold.
Can you feel me touching you, Nicole?
Yeah.
Can you feel that?
Yeah.
Good.
Once we've just got this on, should we just get a little bit of monitoring just to see what her rubs are like?
Right, Nicole, that's going to, you'll feel that going tight on your arm, okay?
Steve and Sammy are checking for signs of internal bleeding.
I think I might be allergic to horses after this.
Oh no. You have to get straight back to it so you don't lose your confidence.
Nicole was trying out a friend's horse for the first time. She wasn't wearing her back protector.
Out of 10, how sore would you say you were? If 10 was excruciating and 1 was really mild?
7 on the lower of my back.
Okay, that's fair enough then, so we'll give you something a bit stronger, all right?
Cold, aren't you, bless you?
Breathing.
Just relax this arm for me, just relax it.
Nicole's symptoms are worrying the paramedics. Spinal injuries aren't always obvious, and paralysis can come on gradually.
Right, Nicole, in a second you're going to feel a little sharp scratch, okay? Here it comes.
Steve is putting a cannula in Nicole's arm, ready to give intravenous pain relief.
Well done. So what we're going to do, Nicole, is we're going to give you a little bit of morphine, okay? It can make you feel a little bit lightheaded, but we'll just go very, very light on it, okay? And then we'll probably give you some paracetamol as well.
You've got DCA allocated ETA 7 minutes, over 7 minutes.
All received, thanks, Gav.
Is it possible you could just send somebody to the end of the road so that then they can meet them and show them where we are?
Nicole will travel the 6 miles to hospital by road.
How's that pain now?
It seems a little bit better.
Okay, you had about a 7 before. Is that starting to come down? 7 out of 10? Yeah? What would you score it now?
It's when I move.
Okay.
If I'm just still, it's okay. It's when I move.
Is it better now you've stopped shivering as well?
Yeah.
Okay. Right, this is nearly run through. By the time this is done, Nicole, then the ambulance shouldn't be too far away. And I'll probably just give you a little touch more morphine before you set off.
Medic 2, DCA just pulling up.
We'll just get this young lady in first because she's very, very cold, and I'll give you a handover once we're in the warm. Okay, you're the head in, so you're calm.
3, 1, 2, 3.
Nicole has been riding for years, but horses can be unpredictable.
There we go. How's that?
She may have back and pelvic injuries and needs specialist care.
She's doing okay, actually. She's really knocked her back. I mean, horses are really heavy, so as it's landed on her, I think it's really squashed her. But so she can't feel the side of her leg really very well. She needs to have some scans in the hospital to see if she's done any significant damage.
She's settled down now. She had a pain score of about 7 or 8 out of 10. She's had a gram of paracetamol and now 5 milligrams of morphine. So her pain settled right down. The main thing is she was really, really cold. My 15-year-old daughter, she rides horses. So it also makes me a little bit wary that the hobby that she's chosen, She's pestering me for a new back protector, so I'll probably be going to buy one at the weekend.
Nicole is heading to Sheffield's Northern General Hospital. Only an MRI scan will reveal the extent of her injuries. At the Nostell Air Base, another emergency is coming in.
So I'm going to send you on this cow job. I know that she's got a hip/leg/pelvic pain, and there's no ambulance.
Dispatcher Mikey is scrambling the crew. Early details are sketchy, but it appears a woman has been trampled by a cow. Paramedics Matty and Rachel are heading for a farm on the outskirts of Bradford.
Doors hammer to stretcher.
Close gear from right.
Engines butterfly.
Dr. Rob is in the cabin. Like the rest of the team, he's been called to cow tramplings before.
We've been tasked to a lady who has reportedly been trampled by cows with possible pelvic and leg injuries. Living in Yorkshire, it's obviously a very rural location, it's relatively common, especially at times when the cows have calves, although it can obviously happen to farmers who get too close and can surprise the cattle, and they can obviously be trampled as well, causing potentially catastrophic injuries.
It's just a 7-minute flight to the small farm in Queensbury.
I've got it as this one below us.
Yeah.
I can't see anybody out there.
Right underneath wires.
Yeah.
But they could be in field, couldn't they?
Well, yeah. Mikey was saying they were in the field and not able to walk.
They're circling the farm.
Right, I've got people down here. 3 people. Yeah, they're all waving. Okay, going in there.
Got those wires, right?
Yeah.
There are major power lines strung across the area. Pilot Gary is highly skilled, but it's going to be tight.
Wires everywhere, isn't it?
Yeah.
I'm going to go where the people are in that yard, in that field there. I know I'm going upslope, just checking round.
All okay on left, mate?
Tail's clear. Windows down. That's it. Clear down.
The patient is lying in the farmyard. 71-year-old farmer Pat Varley is dazed and in pain.
Do you remember everything that happened? No.
Well, yes.
Yes, Sham Black Tower. Sham Black Tower. No. I'm guessing she backed you against this metal pole behind you?
No, she fell over before she got there.
She fell over before she got there?
Walking backwards and fell over.
Yeah.
Cow were in this corner and he turned around and followed her.
Okay, so where have you got pain, sweetheart?
Just here.
Just in this one leg on your right hand side?
Yeah.
Is it in your leg, is it in your high leg, or is it in your hips?
Both.
Both, okay.
Pat can't move. She was tending to her herd's feet with a neighbouring farmer and his wife when the accident happened. They're very worried.
So, my colleague just observations on you.
Check your blood pressure and that. But your chest's all right, you think your breathing's okay.
I've got a nice strong radial pulse, nice and regular. So I'm just going to have a quick feel of this hip, sweetheart, and you tell me where it hurts.
It's just uncomfortable.
Just uncomfortable?
Did you fall backwards, do you think?
Yeah.
Yeah.
Fall backwards.
Did you fall onto your bum at the same time, do you think?
I probably did.
Yeah.
Ow!
Sorry, sweetheart. We're going to bob a line in your sweetheart so we can give you some pain relief. Is that all right?
I don't want a lot of morphine. I don't like that. If you just give me a bit of paracetamol.
Oh.
A bit of paracetamol. Right, so we're diabetic.
Yeah, we are. Type 2.
Little sting coming up now.
What do you take the Rivaroxaban for, sweetheart?
I had an TIA.
Pat's blood-thinning medication, given after she had a mini stroke, means she's at risk of internal bleeding. She's putting a brave face on the pain.
You're not allergic to morphine, are you? Did you say had you had it before?
Not really. Yeah, they make you sick.
And it would give you a very tiny dose. That won't. I think that'll help a bit. Maybe like 2 milligrams would be.
It won't make me go.
It won't. No.
Right.
And then we'll get you some paracetamol to follow that.
We think Pat has more been charged by this cow and fallen, injuring her right hip and thigh. And luckily, because of the situation that they managed to chase the cow off, I think it's more the fall that's caused her injuries. So we're just going to try and package her, give her some painkillers. Yorkshire farmers are very stoical people, and Pat obviously initially refused any pain relief for this, but when we move her, it is going to be a sore thing to do, so we've managed to persuade her to have some paracetamol, but I think she may need something stronger.
Pat came to farming late in life. She has a small herd of beef cattle and knows them all by name.
The one with 64 and it's here's the offending item.
That's the offending one, 64.
Number 64 is called Millie. She's a nursing mother and very protective of her calf.
Right, sweetheart, what we'll do is it's going to be a bit uncomfortable. Okay, so you just might need to grin and bear it a little bit, just while we move you. And we'll give you some more pain relief as and when you need it, all right?
Yeah.
So what we need to do is we need to straighten your good leg out, if that's all right. We're just going to take you...
Yeah.
Oh, well, it's a good job you got wellies on then. Come on, welly, is it?
Right, Pat, we're just going to roll you. So if you just put your hands across your chest, that's it. I'll get your shoulder. I'm just going to roll you on. Are you up, Matty? You're right to support her hip. You're at the bottom of the scoop now, where it's to pull it.
That heavy.
Ow! Sorry, sweetheart.
Yeah. There you go.
Pat fell onto hard concrete. She has a suspected broken pelvis. It's a serious injury with a risk of internal bleeding, made worse by her blood-thinning medication.
You said there will be a...
Pat's neighbour is updating her loved ones.
Yeah. All right, I'll be in touch and let you know what's happening. Yeah. Okay. All right. Okay. See you. Bye.
You'll be able with
I don't know.
Pat is beginning to realise the scale of her injury.
What we're going to do now for is we're going to get a couple of hands on, we're going to carry it to the helicopter.
Yeah, okay.
Think light thoughts makes it a lot easier for us.
Okay.
Okay?
Yeah.
We'll try not to drop you, because that's a lot of paperwork.
Yeah.
Okay?
I bet it is.
Ready?
Sedate lip.
Pat's injuries could easily worsen. She's going to be flown to the nearest trauma unit at Huddersfield Royal Infirmary.
So it's going to get quite noisy, all right, and it's going to be a little bit shaky, but it's normal, okay?
Engines both to flight. Flight, you got it. Confirmed guarded doors, harness to stretcher.
Both skip and right. All booted up nicely.
They're everywhere, aren't they?
You could test from a wire-infested area.
Air desk from 9-8, we've lifted scene, routing to Huddersfield Royal. Secondary over.
There's no helipad at Huddersfield. The air ambulance routinely lands at playing fields nearby, but they need a road ambulance to transfer her.
Pat's looking pretty stable here, so we're just transporting her to hospital for x-rays of the pelvis and hip to look into the damage. Because of the pandemic, the pressure on ambulance services and the NHS is like a bank holiday every day almost. We're possibly going to be forced to wait a while for her to be transported to the closest hospital.
Waiting for the ambulance will take the helicopter and team out of action should another emergency occur. But there's good news.
9-8 header, you've got a crew allocated, 8-minute ETA.
Oh, so we've got some resources.
Cheers, mate, much appreciated. I know it's not been easy, but it is appreciated. Our ETA is 2 minutes.
A smooth transition will allow HeliMed 9-8 to thoroughly disinfect and be ready for the next serious emergency quickly.
Everyone's locked and tight?
Affirmative.
Huddersfield is in view.
Dogs on the lead. Kids are stopped.
Where are you looking?
10 o'clock.
Yeah, I'll turn around and go back to where...
Yep. Air desk 9-8 landed.
They're handing Pat over on the playing fields.
This is Pat. Yep. Pat has been backed into a corner by a cow and then fallen on like the right side of a bum.
Are you all right?
Yep.
Are you all right, Gary?
Yeah.
Pat has serious injuries. She may have internal bleeding, and her age means her bones will take much longer to heal. Her farming days may be over. At RAF Topcliffe, the scramble phone is ringing.
Hi mate, can you set off to a job towards Slingsby, please? It's an elderly person, believe it or not, that's driven into a wall complaining of chest pain, and there's lots of damage to the structure of the building.
Paramedics George and Pete are heading for a village on the edge of the North York Moors.
Engines both to fly. Lift.
It's 18 miles, just 9 minutes flying time for pilot Harry.
Slap bang in the middle of Slingsby village. Right, 6 minutes to run.
Details are sketchy.
An elderly gentleman's been driving along and unfortunately he's crashed into a wall. We're sort of going to this job quite open-minded. We're not really sure if there's injuries at this time.
The patient is more than half an hour by road from the nearest A&E.
York's the closest hospital.
And it's probably James Cook by air, I think.
If the driver is seriously injured, the team will fly them to Middlesbrough, the nearest major trauma centre.
We've got the village here, and you see that tall line of trees on the right-hand side of the village.
Visual, yeah. Low 3 o'clock.
It's an ideal landing pad, except for one thing.
Well, we're into wind at the moment, so I'll probably end up doing a 360 to land. I've also got some very docile sheep that just aren't moving. Tail goods.
George and Pete are off to find their patient.
Hello. I take it you have called for an ambulance?
What's gone on? What's happened then?
It turns out their patient's an elderly female driver. Glenda Hamilton is 82.
I came up here.
Yeah.
And I turned in the road a bit.
Okay.
My foot slipped off the pedal and bang, I hit the shot across the road and hit the wall.
Glenda's car smashed into the house. She was trying to perform a three-point turn.
We're going to get our bed just to the other side of this pavement. Is that all right?
Yeah.
Do you think it'd be OK getting into there?
Yeah.
Local paramedics have started treating Glenda. It looks like she's had a very lucky escape.
How does that feel now you're stood?
It feels all right.
Glenda's being taken to the ambulance for a thorough examination.
Legs up here, darling.
Should we give you a hand with your legs? Oh.
Thank you.
Local people who saw the crash feared a very different outcome.
She was trying to reverse to turn round, and I think she's just missed a gear and gone forward instead of backwards. I could smell burning. I didn't know whether it was the airbags or the car, so I got her out the car. My sister got her a chair, and then Neil came down from up the road just to help us calm her and everything.
Well, I'll tell you what, all the airbags have done the job, haven't they? I think she's just gone past reverse and she's gone into drive. By the look of it.
The fact the airbags went off proves Glenda underwent a significant impact.
Take a deep breath in for me.
Oh, that hurt.
What's sore? Whereabouts? Right in the middle again.
When I breathe.
Yeah.
Lisa, listen to your chest, all right, see what's going on.
And while she does that, I'm going to do another blood pressure.
Well, it won't come down.
No, probably not. Nice and quiet for me, okay?
Switched on, there's no head injury though, is there?
All the airbags, all the sort of impact protection systems all work, so, I mean, it'll have given her the shock of her life, but so far it looks like she's got away pretty much unscathed.
Glenda was on her way to the village mailbox to post a letter.
So where's pain still in your chest, or is it in your tummy or in your leg?
Pain is still in my chest. There's virtually nothing in my legs, just minute.
And just to double check, were you wearing your seatbelt?
Yes, definitely.
Good. Fab.
Britain has 4 million elderly motorists, and paramedics know they're much more likely to be seriously injured in collisions than younger drivers.
What we're thinking about, my love, is...
Having me put down. Having me put down.
That's the vet. That's the vet.
About it anyway, no.
It's far too much paperwork.
What we're discussing is that because you've got this chest pain here,
Yeah.
and because of what's happened and of your age,
Yeah.
we need to get you checked out at a hospital, which will be York today, and get a chest x-ray, maybe a hip x-ray, that sort of thing, just to rule things out.
Yeah.
So like a quick MOT, and hopefully discharge to sweep.
The crash has drawn a crowd, as well as the local police.
I don't know if the officer just wants a quick chat. Is that all right, just before you jump in?
Worried friends and family have also arrived.
She's just complaining a bit of pain in her chest, possibly where the steering wheel might have hit her, but she was wearing a seatbelt and obviously her airbags have gone off, which is a good sign. Seems to be fairly low impact from what she's said as well, but because of her age and obviously this pain, we'd rather take her to the hospital.
Yeah, Andy, we're clear at scene. The patient's going to go to York District by DCA just to get checked up. She's got a little bit of sternal pain. Other than that, uninjured, over.
Thankfully, Glenda's injuries aren't serious enough to justify an air ambulance flight.
Thanks a lot.
No worries.
But the patient's car is in a much worse state. Police have called a tow truck to drag it clear. The locals are wondering about the team's choice of helipad.
You didn't manage to get a couple of sheep on the way down?
No, managed to avoid them.
Lamb for lunch.
That's an idea.
Helimed 99 is heading back to base to await news from A&E in York. It's believed unclear road markings were a factor when a van pulled out into the path of Viv Crozier's car. Viv hit the van head-on at 40 miles per hour and was trapped in the wreckage. 9 months on, it still brings back distressing memories.
There was a witness, a lady who came and she actually sat in the car. Sat in the car with me because it was quite traumatic. And I would just like to say thank you. Thank you to her, and also thank you to the girl from work who came and sat in the car with me as well. And the doctor from the air ambulance, she was in the car with me as well as at various points, and They just put their own life at risk to save yours, and you don't realise until you're stuck in a car like that how important they all really are. I was lucky it wasn't worse. Probably saved my life, that little car.
Viv's injuries were serious. She broke her back, ankle and foot, and is still recovering.
I had to learn to walk again. What's helped me get through this time at home is my family, everybody who's come to visit me, everybody who's taken me out for the day, music, and, of course, knitting.
Golfer John Anderson, who suffered a cardiac arrest on the Fairway, was rushed straight to surgeons.
It looks nasty.
Despite his mate's CPR, John had crucially been deprived of oxygen for several minutes.
You collapsed on the golf course, sir.
I was out for about 8-9 minutes. Thankfully, my friends were there to keep me alive. I didn't realise, but once, obviously, your heart stops, then everything else in your body stops as well. So if it had been any longer, I could have ended up with some brain damage or something like that. So I've got a lot to thank them for what they've done for me.
Surgeons fitted John's heart with his own small electronic defibrillator to restart it if it ever happens again. He's recovering well.
Technology is just brilliant. My son set up a Just Giving page and he managed to collect £1,500, and we'd made a donation and they've managed to have a defibrillator fitted at the club. So it should make a difference.
Nicole Wayman underwent an MRI scan and checks in hospital after her horse fell and crushed her lower back. She suffered bruising to her back and hips and was given the all clear from doctors. 2 days later, she was back in the saddle. X-rays in hospital revealed farmer Pat Varley broke her pelvis when she fell after her prize beef cow Millie became agitated and ran at her. She spent 3 months recovering, but is still farming. 82-year-old Glenda Hamilton had a nasty shock when a 3-point turn went wrong and she crashed into the side of a house. Thankfully, Glenda emerged with just bruising. She's since given up driving after 34 years behind the wheel.